All right, welcome. As a pharmacist, you're right there on the front lines of patient care, one of the most accessible healthcare providers we have. So today, we're going to dive into the key clinical knowledge you need to manage medical abortion with confidence and, most importantly, with safety.
So let's just set the stage for a second. Globally, a staggering 40% of all pregnancies are unplanned. Think about that. This isn't some rare event. It's a really common and critical part of reproductive health care that you are absolutely going to see in your pharmacy.
And that's exactly where you come in. Your role in providing safe, effective, and non-judgmental care is it's vital. So let's get right into what you need to know to make that happen.
Okay, here's our game plan. We're going to follow your workflow. We'll start with your role, then get into the nitty-gritty of the medication regimens. After that, we'll cover the crucial patient safety checklist, and we'll wrap up with the essential counseling points that really ensure a safe outcome for your patient.
All right, first up, your role. Let's just define the clinical landscape and really understand the why behind this therapy.
So what are we trying to achieve here? Well, the goals are pretty clear-cut. Number one, obviously, is to safely terminate a first trimester pregnancy. Number two is to prevent and manage any side effects or complications. And number three, and this is a huge part of your role, is to get an effective contraception plan started for the future.
Okay, on to Section 2, the medications themselves. To hit those goals, you'll be dispensing some specific drugs. Let's compare the main options you'll see.
Now this table is super helpful because it lays everything out side by side. You can see right away the mifepristone and misoprostol combo isn't just a little more effective, we're talking up to 99.8%. It's also way faster. It works in about half the time. And that clinical superiority is exactly why it's the only regimen that's actually approved by Health Canada for this.
When you're counseling, explaining this two-step process clearly is everything. So day one, it's one 200 milligram mifepristone tablet, taken by mouth. Simple. Then, and this is the key part, 24 to 48 hours later, they'll use the misoprostol. You need to be specific. 4 tablets placed buccally, that's 2 in each cheek, and they just let them dissolve for a good 30 minutes before swallowing whatever is left. Getting these instructions right is essential for it to work.
Okay, moving on to one of the most important parts, patient safety. Now that we know the regimen, we have to talk about the critical safety checks. Before you even think about dispensing, you've got to screen for contraindications.
These right here are the absolute non-negotiable deal breakers. You have to verify that none of these are in play. Things like a suspected ectopic pregnancy, chronic adrenal failure, or if the patient is on anticoagulants. These make medical abortion unsafe. It requires an immediate referral for a different approach. This step is your safety net.
And let's just zoom in on ectopic pregnancy for a moment, because this is a life-threatening emergency. Here's the scary part. The symptoms of an ectopic pregnancy can actually mimic the side effects of the medication. This can tragically delay a diagnosis. That's why you have to know these risk factors. A history of PID or a previous ectopic, those are major red flags.
And all of this brings us right to the heart of your role, patient counseling. This is where your expertise really shines. It's where you empower the patient with the information they need to have a safe experience at home.
First things first, you have to manage expectations. You need to be upfront and tell the patient to expect bleeding that is heavier than a normal period and cramping that is more severe than their usual menstrual cramps. Explaining that this is normal, that it's an expected part of the process, and that it usually kicks in a few hours after the misoprostol, that alone can prevent a ton of anxiety.
And the great news is you can empower them to manage these symptoms. For the pain, NSAIDs like ibuprofen are your first choice. For nausea, something like dimenhydrinate is a great option. Diarrhea? Loperamide can help. And you should also give them a heads up that things like chills or a low-grade fever on the day they take the misoprostol are super common and temporary. It's just the prostaglandin at work.
Okay, now for what is arguably the most critical part of your counseling, the red flags. You have to give the patient clear, specific symptoms that mean, go get medical help now. Be really concrete. Excessive bleeding means soaking more than 2 large pads an hour for 2 hours straight. That's an emergency. Same with severe pain that the painkillers just aren't touching, or a fever that hangs on for more than 6 hours. These are their safety instructions.
Lastly, let's talk about what's next. You absolutely need to counsel patients that fertility can come back incredibly fast. I mean, ovulation can start up again as early as 8 days after the procedure. And that's exactly why hormonal contraception, the pill, the patch, the ring, can and should be started on the very same day they take the misoprostol.
It's also really important that we touch on the mental health side of this. The research is pretty clear. The medical abortion process itself is not linked with long-term mental health problems. What really matters is a pre-existing history of mental health conditions. So your role here is to provide that compassionate care and know when a patient might benefit from a referral to get some extra support.
So, I want to leave you with this final thought, which goes beyond the clinical facts, right to the heart of patient care. It's a question for you to take back to your practice. How can you actively create an environment that maximizes privacy, choice, and safety right there at your pharmacy counter? Because applying these principles of trauma-informed care, well, that's what turns good clinical knowledge into truly exceptional patient care.